very good.
I had sore throat.
Don't breathe on me.
Representative Connolly.
Here.
Flitner.
Here.
Hallinan.
Here.
LeBeau.
Here.
Ottman.
Here.
Romero Martinez.
Excused,
Stivar.
excused,
Work.
excused.
Madam Chairwoman.
I'm here.
Madam Chairwoman, we have 6 present.
Not really excused, but, okay. What's that? I don't, he doesn't, he'll do what he does. Just try not to breathe on us, Representative Hallinan.
Excuse me, does he need a mask? Is he that sick?
He's the doctor. I'm not gonna make a prescription for him.
Well, I just-
He ought to have enough.
We're asking.
Representative Hallinan, some people are wondering if you feel that you need a mask. Feel free to do whatever you prescribe for yourself, but consider the rest of us as well. Okay,
They want me to. They have one.
I don't know if we have any. Oh, look at Representative LeBeau. She's brought it down from the casino, I guess. No, I'm just kidding. I should turn off. Thank you, Representative Hallinan. Nursing home administrators, do we have, are you from the, sorry, I can't recognize you very well. Are you from the board? Yes. Oh, would you like to present this for us? That would be really helpful. Thank you so much. And Representative Ottman will present it on the floor. So if she seems to ask a lot of questions, it's because she's prepping. Welcome.
Thank you, Madam Chair.
Is the light green at the base?
It is.
Good job.
Thank
Go
you,
ahead.
Madam Chair. Would you like me to hit the highlights or go through the bill?
I think, why don't you just give a short summary, because we haven't really heard this since June. And then, I think if you just go over the changes, and then we'll let Representative Ottman ask the questions that she feels might be necessary. How about that?
Thank you, Madam Chair and committee members. My name's Emily Crombaugh. I'm the Executive Director for the Wyoming Board of Nursing Home Administrators. And
Madam Chairman, Eric Boley with Wyoming Hospital Association and Leading Age Wyoming.
Go ahead, tell us about nursing home administrators.
thank you, Madam Chair. There are 3 main revisions to this bill, this Board's Practice Act. One is to add background check authority, and you'll see that done in both the Board's Practice Act and the DCI statute. The second is to add continuing education authority. There is some question as to if the board has explicit authority or implied, and the board would be more comfortable if the legislature made that explicit for them. The third is to update board membership requirements, and that's a 2-prong approach by clarifying Wyoming practice requirement and removing the Department of Health designee. I will note the Department of Health designee is not counted among the 5 board members in this statute. Additionally, a representative has not been appointed, and that ex officio seat has been long vacant. Mr. Boley did speak with the Department of Health Interim Director, Stefan Johansson, and he confirmed he had no issues with this removal.
Okay,
Those are the 3 main items, and I would be happy to walk you through the bill if you'd like at this time.
I think let's just do that.
Members of the committee, the first change starts on page.
I'm sorry, actually, and even just for the education of the committee, just give us a very brief summary of what it takes to be a nursing home administrator. I mean, we assume there's degree requirements or that kind of thing, or a license, an exam, whatever is required for that, just in a brief sort of way.
Yes, happily. Madam Chair and the committee, there are requirements to become licensed include award of a bachelor's degree or an associate's degree in a healthcare-related field. There's a requirement that you complete experience at the national standard we call the AIT, and there is a national examination required as well. Those are essentially the 3 main components to licensure. Obviously, there's the application fee references in addition.
Okay. All right, so committee, just to this was, as we recall back to June, this was basically an updating, it's not a new licensure, it's the licensure that we have had throughout. The page 2 is the fingerprint and criminal background check. And I'll say, I personally, I did work in a nursing home in California, not as an administrator, but as staff. And, you're dealing with a very vulnerable population, and people at least there, they often have funds that are kind of kept at the nursing home for the patient's use to, purchase things or do whatever. A very sad experience. So about 2 months after I left that nursing home to move, I found out that the business office manager, didn't have to be a licensed nursing home administrator, but was the business office manager, had actually been, what do you call it? Not absconding, when you take the people's money, what is that called? Embezzling from the nursing home account for several years. Ended up doing jail time, and she was like 30 years old, had 2 little kids. Remarkably foolish and horrible behavior. But so, just because of especially because of the population and the potential for bad behavior, I think that's a good thing. So as the witness shared, then page 3. And I'm just kind of steering you along, Representative Ottman. Okay, so page 2 was the fingerprints and background check. Page 3 is the removal of the ability to have the ex officio member of the board from the health department. Bottom of page 3, and we might want to hear a little bit more about this from Mr. Boley, about maintaining the addition of the wording maintain employment. Page 4, that it just is another part of the background check business. And the top of page 5, continuing ed. Maybe, can you just tell us what the continuing education requirements are?
Madam Chair, yes, I can. I regret that I am a new director to this board. I have 5 others I'm a lot more familiar with, but I did bring my rules in case.
Well, Mr. Boley might be able to help you answer. He's a knowledgeable fellow.
Madam Chairman, currently, before COVID, was required for administrators to have 25 hours of CEU a year. Our association, Carolyn Pasnell's association, actually help facilitate those training sessions. We usually have 2 or 3 conferences a year and bring in experts to help the administrators be better at their jobs.
Okay, and so this is not an upgrade of the number of hours. It's just stating.
It's
the
just
requirement.
codifying that, Madam Chairman.
Okay, any more questions? I'm sorry, what was your name again?
Madam Chair, it's Emily Cronbaugh.
Could you spell your last name?
Absolutely. CRON as in Nancy, B as in boy, AUGH.
Okay. Thank you. Okay, any questions for Ms. Cronbaugh? Representative Ottman?
Yes. What I was wondering, to just kind of review it, first off, may I have a copy of your notes? Would that be possible? Yes. And then what I was wondering is with the identification and the criminal backgrounds and the continuing ed, are these things that have already been going on and we're just enhancing them or putting them in statute, or?
Madam Chair and Representative Ottman, the continuing education has already been in the board's rules, and licensees have been required to complete that. With different legal advice, that was questioned, and that's why that's being added now. The background checks, the board has not had authority previously, so that's never been done for this board.
Thank you, Madam Chair. Ms. Cromwell, so since this is a national board certification, these licenses then can travel from state to state without any other matters?
Ms. Cronbaugh?
Madam Chair and Representative Ottman, no. This is Wyoming's license requirements. Wyoming, as much as possible, tries to align with national standards to ease in reciprocating. But these are not national standards. These are just the board's rules. I believe Mr. Boley could clarify a little better for me.
Mr. Boley?
Madam Chairman, Representative Ottman, so the license is transportable, but you still have to apply in each state to receive that state. We don't have a reciprocal agreement in place, or we don't have a, why am I losing my train of thought here?
There's not a compact.
Compact, yeah, we don't have a compact yet for nursing home administrators. And no intentions of bringing one right now either.
Right, so the national part is just the test. I mean, everybody, I guess, takes the same test. Correct. Okay. Yeah, Representative Stivar.
Thank you, Madam Chairman. On page 4, there's line 23, it'll expire the 31st day of December of each year following the issuance. Can we make that a 2-year license instead of a 1-year license? Why would we do a 1-year license with this?
Ms. Cronbaugh or Mr. Boley?
I think, Madam Chairman, Representative Stiver, it has to do with the need to have the continuing educations on an annual basis is why it has to be done annually as opposed to every 2 years. And it's a simple process for us, trust me. I've been doing it for 20-something years. It's just an application and sending in proof of, updating your information, sending in proof of your continuing education, and submitting your license fee.
Any more questions? Representative Hallinan. Oh, I'm sorry, we'll let Representative
So
Stivar.
if we do a 2-year license, you still have a requirement to send your CEUs in, but that would take the burden of having another license fee onto that.
What is the fee annually?
Madam Chair, it's 300.
Okay, Representative Hallinan.
Thank you, Madam Chairman. Is it required that they have this background check at the time of the renewal of their license?
Ms. Cronbaugh.
Madam Chair and Representative Hallinan, no, that is only going to be a requirement for new applicants.
Representative Flitner, did I see your hand?
Yes, ma'am. Thank you, Madam Chairman. And back to the fee, just because my good friend here he's on it. So the $300 annual fee, what does that go toward?
Ms. Cronbaugh.
Madam Chair and Representative Flitner, the licensing boards under the A&I Professional Licensing Board Office, of which the Nursing Home Administrators Board is one of 20, they are self-sufficient. So their fees go majorly to administrative costs, but they could go to board supplies, board travel reimbursement for in and out of state travel. So this goes directly to the board's operations because the board is a self-sufficient board.
Okay, follow up. And would you feel like if that went to a 2-year fee, would that be an impediment to your administration and all your supplies? I mean, is that really, I mean, I'm sure you don't have a surplus of funds, but
Representative Flitner, are you asking if we instead gave them 2 years for $300, or if we just said renew every 2 years and pay $600?
no, renew every 2 years at $300. So I'm trying to get to Representative Stivar's, I just want to kind of flesh
So
that out a
in
little
other,
bit.
okay, but, so then they might not be self-sufficient.
That's
Ms.
my
Grunbaugh.
question, yeah.
Madam Chair and Representative Flitner, the board's budget is created based on that revenue of receiving what would be those $300 payments annually. So ideally, biennially, then they would charge $600.
Okay.
Administratively, yes, it's easier to not have a renewal cycle, but cost-wise, there's still additional costs that the board will continue to maintain despite not renewing annually.
Representative Stivar.
Thank you, Madam Chairman. How many of these people are licensed in the state to be a nursing home administrator?
Ms. Cronbaugh.
Madam Chair and Representative Stivar, the board currently licenses 79 active nursing home administrators. 56 of those reside in the state. Rather, they have provided an in-state address. The board is dependent on the information given to them, which would be 70% of those license holders.
It's not very many.
Yeah, Madam Chair, that's $22,000 a year to run the board. 23,000, something like that.
Okay, more questions for Mrs. Cronbaugh or Mr. Foley? Mr. Foley, do you want to add any other remarks on your own?
Well, Madam Chairman, committee members, just to give a little bit of context, and I shared this as we brought this to the interim. I served on the board for a number of years until I was no longer an active nursing home administrator. I still carry my license. One of the clarifications in here is that it has to be an active in-state nursing home administrator that serves on the board. And we actually had a situation not too long ago where the nursing home administrator was let go and moved out of state, but there was really nothing in statute that said that they couldn't continue to serve on the board. But we think it makes sense to have in-state nursing home administrators help with the board. And so I think it's a really good clarification. I would also add that background checks makes a tremendous amount of sense. There aren't many situations, but there have been situations where there have been misappropriations of funds and other things. And as Madam Chairman said, we're dealing with the most vulnerable, and we don't want to betray their trust. So I think a simple background check makes a great deal of sense. And it's one of the only professions that I'm aware of where you have a license, but you don't have to go through that background check.
Okay, more questions? Representative LeBeau.
Thank you. Mr. Boley, what's the average service of a board member on the board? Like how many years, what's an average that they serve on the board?
Mr. Boley.
Madam Chairman, if it's okay, Representative LeBeau, I'll defer to Emily. I've seen them last for a long period of time, and others, sometimes we actually have a hard time filling those positions because the nursing home administrators are so busy, but I don't know if we have a term limit in our statute.
Madam Chair, Representative LeBeau, there is no term limit, so it's truly up to that serving member how long they'd like to serve, provided the governor continues to reappoint that individual.
And they are, the length of their term is, I don't see that we've pulled that part of the statute in.
So we do it every year or 2 years from the governor?
Is there another part, is there a section C in that statute? I see A and B has been brought in. Must say, the title says terms, so there must be a, we must have a term, it's not pulled in.
Madam Chair, it is 4 years. I believe that section is simply just not part of the revisions.
That's fine. Okay, more questions. Remember, guys, we're gonna try to do 3 bills. Representative Ottman.
Madam Chairman. Don't forget, I need your notes. And secondly, are these positions reimbursed, are they paid, or is there any sort of?
The board, you mean?
Yeah.
Madam Chair and Representative Ottman, the board receives compensation for travel but not salary. So they would be reimbursed $109 a day. They do get the legislative reimbursement rate, and they receive mileage.
For the meetings.
Yes, ma'am.
Okay, any more questions? Okay, is there any testimony from the rest of the
Thank you.
world on this bill? Is there anybody online at all for these 3? Okay, come on up, Ms. Passano.
Thank you.
Welcome, just introduce yourself for the record, if you would.
Good morning, Madam Chairman and the committee. Carolyn Passano with the Wyoming Healthcare Association. Just a couple of things, and I will be, Ms. Comsbra and I will be speaking later about this issue, but I thought I should bring you up to date. I have had 1/3 of the administrators in our association change since COVID started. And we have been very fortunate to find good people to make those changes. Right now, I have someone that has come from out of state that would like to be the administrator of one of our association nursing homes, but does not have the bachelor's degree. I checked the background, and that individual is very upstanding and has experience as an administrator. That's pretty important right now when you think that the President of the United States has extended the emergency, but as far as I know, there's no end, no time limit on that. And with current situation abroad, I doubt that there's going to be much of a look at nursing home issues domestically. And we do need this individual as an administrator because of that experience. And it's when you think about a third of the administrators leaving and needing to find more administrators, that experience seems to me to be very important right now. We can take a look at this in rules and looking at, I mean, I never really gave the idea a thought before having a bachelor's degree. What if it's microbiology? Who cares? What if it's chemistry? It would be great if we had a look at if it were counseling or even teaching with skills that go with what an administrator needs. I think we have to take a look at what we've got, and we have time to do that. I'm a little desperate right now for that administrator to be sanctioned with perhaps a provisional. There is no provision for a provisional license that would extend so that individual can find time to do the actual bachelor's degree or what is needed. Experience seems to be at the top of the list right now as the community is still getting COVID cases, and as the community has COVID, so too does the nursing home. And if you look at the map, that's where we are in Wyoming right now, that we are still getting those cases and we're still having deaths. So I'm not asking you to put the amendment on this bill. I'm just updating what you would know as we go forward. So thank you for letting me do that.
So maybe an interim topic, are you suggesting?
I'm suggesting we might want to do that. It seems that we're going to be lengthening out this whole idea about what we need as we go forward with COVID. That's the issue.
Representative Ottman.
Thank you, Madam Chair. Ms. Passano. What I'm hearing is definitely a need for looking at. But what I was wondering was, does this person, because I heard Director Boley say that you could also have an associate's in healthcare. Does this person have an associate's, or could they get one, or is there? I was just wondering about that. Thank you.
Yes, Representative Ottman, we're hoping that that could happen and that he then could be, he is working on a degree, as a matter of fact, right now. And very capable person is, and I know that you can't make a rule on one person, but I'm guessing that we aren't done with COVID and its variants, and there might be some other reason down the pike that we need to look at a provisional license.
I'm guessing as we age, we're probably not done with the need for nursing home administrators. Speaking more broadly. Any more questions for Ms. Passano? Okay, thank you so much. Remind us of that when we do interim topics. It sounds like a good topic. Any more testimony on this bill? Okay, then public testimony is closed. Do I hear a motion on the bill? Moved and seconded, moved by Flitner, seconded by Stivar. Is there any discussion? Question being called. Bonnie, would you call the roll, please?
Representative Connolly. Flitner. Hallinan.
Aye.
LeBeau. Ottman. Romero Martinez excused. Stivar.
Aye.
Worf excused. Madam Chairman.
Aye.
Madam Chairman, we have 7 ayes, 2 excused.
Okay, and Representative Ottman will run this bill on the floor. And feel free to call upon us if you find that your notes missed something. Okay, the next up is Senate File 24, Pharmacist and Pharmacy Technician Practice. Representative Stivar, I had been planning to assign Representative Worf to floor manage this bill, but he's not here yet, so I'm gonna assign you. So be alert, make notes.
No on the bill, so, you know.
I'm sure you can fairly present anything that comes before you, Representative Stivar. Not anymore, you're not. Mr. Martineau, are you going to present the bill for us, or at least remind us of what it was?
Madam Chair, I'm at your pleasure, so whatever you want me to do.
No, I think you should refresh our memory because, you know, we haven't really considered it since June and we may not be all that sharp.
Gotcha. Madam Chair, members of the committee, my name is Matt Martineau. I'm the Executive Director for the Wyoming Board of Pharmacy. A little bit of history. During the pandemic, the federal government utilized the Public Readiness and Emergency Preparedness Act, otherwise known as the PrEP Act, to take various measures to make sure that patient care was not being adversely affected during the pandemic. And a lot of things that were done with the PrEP Act in the pharmacy world were to expand the things that pharmacists and technicians could do. And one of the things was to make it to where technicians could aid in vaccination efforts. And so what the bill essentially does is make sure that this workforce that's been mobilized to be able to administer vaccines and help ease the workload in the pharmacy is able to continue whenever the pandemic is declared to be at an end.
So just to be clear, before we ask, that would be any vaccine. I mean, flu or measles or something like that. Tetanus, whatever.
Madam Chairman, yeah, that's correct.
Just
It
making
allows
sure that
the,
we're all
yeah.
not too
It-
tied
it's
to
not-
COVID.
It's not only specific to the COVID vaccine, it's to any vaccine that the pharmacists are allowed to administer.
Okay, carry on.
So in a nutshell, that's ultimately what the bill does. It also addresses a couple of other points. It makes it clear that interns are also allowed to administer vaccines under the supervision of a pharmacist. And then it removes the statutory definition of direct supervision. It still requires pharmacy technicians and interns to be under supervision. It just doesn't have to be what was previously defined in statute, which seemed to imply that the pharmacist had to almost be at the hip, so to speak, being able to intervene immediately. Technology and a lot of other things have advanced to where there's things that the pharmacist can still be in that process and provide the supervision, but they don't have to be all the time right there pushing an override button, so to speak.
Okay, so actually, just looking over this, going through pages 1, 2, 4, and 5, the only changes on those pages is the removal of the word direct. Is that right?
Correct.
Okay, and then on page 3, so just, and that's the definition of supervision? I'm not reading as fast as you're talking.
Page 3 is the part that spells out and allows pharmacy interns and pharmacy technicians to be able to administer vaccinations under the supervision of the pharmacist. It's permissive. It doesn't require the technicians to have to do it. So technicians that want to do that, all they have to do is take the required training, which involves an 8-hour online instruction portion. So can they tell the difference between the vaccines? Do they know which ones are which? And then there's a 4-hour live portion, so a 12-hour training altogether that involves an assessment of their technique and making sure that they can correctly administer the vaccine then.
Okay, so just to make sure then, so the ability of technicians and I suppose interns to administer immunizations was a blanket part of the PrEP Act, not previously in our statute, and this adds it now to our statute. Do I have that right?
Madam Chairman, yes.
Okay. Right. Any other things you want to say before I open, any questions for Mr. Martineau? Representative Stivar.
Like Representative Ottman, I'd like to get your notes.
I'll make some notes real quick for you, sir.
Representative Connolly.
Thank you, Mr. Chair. Mr. Moore, I guess first it's a comment and then a question. I'm really intrigued and thrilled by this piece of legislation because for me, what it is a recognition of some things that we learned from the pandemic. And in this case, it is maybe our over-regulation and the recognition that with the pandemic and those regulations were loosened, that in fact it worked. So and that you came back to us and said, look, this worked. Why should we stop it? Because it would increase healthcare access, honestly. So my question is, though, in terms of what you learned, did you run into any problems with having technicians do the administration, or was it perfect? I mean, I'm okay if there were a couple little problems, but I am just curious about this expansion of the duties of technicians.
And actually, if I may add to that question, but just building onto it, Mr. Martineau. So I remember I was on Labor Committee before when we added the vaccination ability to pharmacists in general. Does the Board of Pharmacy, well, first let me back up. Do the pharmacists have to turn in any kind of report for negative reactions to a vaccine I'm not expecting them to track a person for 2 weeks, but suppose the person, passes out in the produce section or something like that. Is there a report that goes to the Board of Pharmacy? And if there is, was there any tracking on differentiation between who gave the vaccine? So just pile that on to Representative Connolly, if you would.
Madam Chairman, Representative Conley, there have been hiccups. It hasn't been 100% perfect. The complaints that the board has received involved concerns about whether or not an individual received the correct vaccine because the workflow is a little chaotic and there was multiple individuals in the vaccine room, one getting a flu shot, one getting the COVID shot, and the technician inadvertently recorded the wrong vaccines on the administration cards for the patients. On investigation, it turned out that the other paperwork lined up and the staff knew that they had given the wrong thing. So far, knock on wood, it's only been paperwork problems. And those have been easily addressed, both in terms of correcting the record and putting more training in place to make sure that that's not something that continues to go forward. With respect to when adverse events happen, the board doesn't require that to be reported to the board. It's required to be reported into the FDA's vaccine adverse event reporting system, or the VAERS system. And so whether it happens within the first 15 minutes or hour, whatever, that the patient is in the pharmacy or grocery store, whatever, shopping, as soon as the pharmacist is made aware, or even afterwards, you can sometimes have skin infections or things like that. So the patient will notify the pharmacist. The pharmacist will collect all the information and put that into the report and make the FDA aware of it. And then that goes into the whole assessment machine that is the FDA when determining what was really going on. Was it an adverse event? Was it improper technique? Was it something else?
Follow up.
Keep going.
Circle back anyway.
Just a quick one. I'm curious about the ability for the technician to make a choice about immunizing children.
Mr. Martineau.
Madam Chairman, Representative Conley, can you clarify? I'm not sure I understand.
Sure, Mr. Martineau, on the bill on page 3, that there is, starting on line 15, there says that there's nothing in this subsection shall be deemed to require any pharmacy technician to administer immunizations to individuals who are less than 13 years of age, and that technician can't be discriminated against, fired, et cetera. So it's a choice of the technician about immunizing children. And so I'm just curious about that.
Madam Chairman, Representative Conley, that language mirrors what's in place for the pharmacists. The pharmacists have a similar thing that it's all voluntary. that they're not being compelled to have to do that, and then that the employer can't terminate the pharmacist or the technician for refusing to administer vaccines to a patient group that they may not feel comfortable being able to administer to.
And when the bill, I don't know what year it was, maybe 2016 or around about there, when we authorized, or 14, the pharmacists to do vaccinations, that was part of the discussion then, because of, and I'm speaking for them, and I may be speaking, I don't want to misstate, but we kind of got the impression that, especially a lot of the pharmacists who had been practicing for a while, felt that they hadn't received training in pharmacy school on giving vaccinations. And of course, there's a little bit more of a, I don't want to say potential harm, but just given the mix of vaccinations to pediatric patients. So I think that my recollection is that age requirement was put in then. There was a lot of discussion about whether this was be put into the rule, yeah.
Yeah, Madam Chairman, it had really to do with where the vaccine had to be administered. Up until a certain age, above a certain age, you're giving it into the deltoid muscle of the individual. And below that age, you're having to administer it into other locations like the thigh or something else like that. And so I think that's where the concern was different administration sites and not having room set up to where you could have a small child and try to administer the vaccine that way.
Very good, good clarification. More questions for Mr. Martineau? Okay, is there any other testimony on this bill in the room? You can stay there or go as you wish, Mr. Martineau. There's not such a shortage of chairs today that we, welcome, introduce yourself for the committee if you would.
Madam Chair, committee members, I'm Melinda Carroll, pharmacist. I'm here representing NCPA, which is the National Community Pharmacy Association, and WPHA, the Wyoming Pharmacy Association. I'm here to testify in favor of this bill. Pharmacists have a lot on their plates, and this has enabled them to provide better patient care. And if the PrEP Act does go away, as Dr. Martineau said, we will not be able to have that resource, which would be detrimental to patient care. So I would encourage the committee to vote yes on this bill and send this through, and I would stand for any questions.
Questions for Ms. Carroll? Representative Ottman.
Madam Chairman, Ms. Carroll, you said if the PrEP Act goes away, is there a sunset on it or something?
Ms. Carroll.
Madam Chairman, Representative Ottman, currently the PrEP Act is set to expire in October of 2024 unless the pandemic is declared over before that or if it's extended beyond that. So currently that's the deadline that we're aware of.
Representative Ottman.
So this statute then would make it so that this was a continuous thing and not based on a pandemic or a problem, it would just be policy.
Madam Chairman, Representative Ottman, that's correct. It would make it to where the pharmacist who's able to immunize and then the technicians who are able to immunize, that they can continue to do that, and the pharmacist can direct the workflow in the manner that is most efficient and safe for patients and for the pharmacy.
Ms. Carroll, I'm asking you to speak broadly on averages, which I know is challenging, but what's the rough ratio of pharmacists to tech in an average pharmacy? Would you know, 1 to 4 or something, or either? of you?
Madam Chairman, that is generally dictated by your labor model and how many hours you earn. I would say that it is probably right around 1 to 4. That would depend on how busy the pharmacy is. Sometimes it's as little as 1 to 1, and sometimes it's as large as, I'd say 1 to 6. You probably don't see many more than 6 at a time.
In a hospital, would there be a different ratio?
Madam Chair, yes, you would see a different ratio in a hospital. Oftentimes, hospital pharmacists do not administer vaccinations, though. That is generally taken on by the nursing staff in the hospital setting.
Okay, great. Any more questions for Ms. Carroll or Mr. Martineau? Any more testimony from the audience? No? Okay, then. Public testimony is closed. Do I hear a motion on the bill? Moved by Flitner, seconded by Ottman. Any discussion on the bill? Question being called. Bonnie, if you would call the roll, please.
Representative Connolly. Flitner. Hallinan.
Aye.
LeBeau. Ottman. Romero Martinez excused. Stivar.
No, aye.
War.
Aye.
Madam Chairman.
Aye.
Madam Chairman, we have 8 ayes, 1 excused.
Okay. Representative Stiver, do you still feel able to run the bill? Thank you.
He's gonna give me notes.
There you go. Although I kind of got the impression he was speaking from his head, so. Okay. Yes, Representative Connolly.
Thank you, Madam Chair. And I know there's not many people from the healthcare community, but again, I really appreciate that, that an organization, members kind of learned something from the pandemic and then came to us for a statutory change that will honestly help not only the profession, but I think access to healthcare. And the more of that, the better. You know, if we've learned things and we can change them in our statutes, I want to do it. And that I would just hope that we get more of it as time goes on.
And I had.
Representative Stiver.
Connolly to help me out too.
There you go. We'll all help you, Representative Stiver. Okay, the final bill, and folks, let's see, we're really doing great here today. That doesn't mean you should ask Representative LeBeau a lot of questions, but I'm pleased. Senate File 101, Epinephrine and Naloxone Administration Authority, and it looks like Senator Rothfuss is delegated entirely to Representative LeBeau, who obviously will be a capable person, and will be running the bill on the floor. And maybe you could go train the reading clerk on this bill. You seem to be having a little trouble. Okay, Representative LeBeau, go ahead and tell us about this bill. Actually, wait 1 minute. I need more coffee. Hold on 1 minute. Start and stop.
Oh, really? Oh. We all do things like that. That one though is important. It's not like me leaving my computer. Yeah.
I know as soon as we're done here, we gotta run up there. But I do apologize. I hate that.
Well, you honestly, by being late, you were being assigned this last bill and Clarence got it.
Great.
Yes.
I'm glad that we got Representative LeBeau. But I would gladly help if you need anything. But all I can do is probably say is vote aye.
This committee, we ran out of coffee, so we had to make tea.
I got the last of the coffees.
That's right. We need to strengthen him for running the pharmacy bill. Okay, Representative LeBeau. My apologies. Go ahead.
Madam Chairman, members of the committee, I'm Andy LeBeau, representing House District 33. I'm a co-sponsor on this good little bill, as my colleague from Acosta Hall said. So I bring to you Senate File 101, Epinephrine and Naloxone Administration Authority. This bill comes out of the circumstance within the state where over the years legislation was passed for 2 life-saving measures related to epinephrine and naloxone. About 5 years, legislation was passed that provided for statutory authority under what is called the Emergency Administration of Opioid Antagonist Act, whereby entities, where that's broadly defined, would be able to get a prescription for and utilize naloxone under a circumstance where an individual is experiencing an opiate overdose, which is a life-saving measure. The idea being that one doesn't necessarily go out and get their own prescription for the opportunity. Should they overdose on opioids, they would need somebody who might be with an organization to have the authority to get that prescription and then utilize that for life-saving measures. Also earlier, legislation was passed that allowed K through 12 institutions to have on hand EpiPens so that they could provide life-saving measures under circumstances where their students might undergo an anaphylactic reaction and then provide with emergency response and first aid as part of their first aid kit, the authority to have the prescription on hand. It turns out the legislation did not cover everybody with both. So presently, there is no ability in community colleges or the university or with other organizations, for instance, your church group, your daycare provider, or your after-school program, or even as was pointed out in public testimony, the Wyoming State Legislature, to have a general prescription for epinephrine so that we have an auto injector on hand in case someone does experience an anaphylactic reaction. And we would want that in our first aid kit. So, Madam Chairman, this legislation simply goes into statute, and the way that it is crafted is to go into the Emergency of Administration of Opiate Antagonist Act, which was passed, again, like I said, a few years back. You'll see on page 2, we change it to the Medical Treatment Act, and then we simply go through the entirety of that act and allow for the opportunity for a general prescription for an epinephrine auto-injector, so an EpiPen, under the same circumstance where we would have the authority for one of those naloxone general prescriptions, thereby providing the authority to basically any entity, which we will see defined on page 2, and expand it to explicitly include the college, the University of Wyoming, and the community colleges, because there was some question as to whether this act previously would ever covered them under entity. So just providing that clarity, which I think was the intent, to provide for that opportunity to where there is an emergency need for an EpiPen. It could be on hand with the first aid kit. There's already requirements under the previously existing statute for training from the pharmacy and assurance by the pharmacy to see that there is justification for having need for that within your first aid kit. So it's just not a general prescription for all. You'd have to demonstrate specific need, but that program has worked well over the years, and we haven't heard any complaints, certainly with regard for naloxone. This bill would provide broader coverage for EpiPens so that we have another option on the table to provide life-saving measures and potentially save a life with this legislation. With that, Madam Chairman, I'd be happy to answer any questions.
Okay, committee, any questions for Representative LeBeau? Representative Ottman?
Thank you, Madam Chairman, Representative LeBeau. I just have one question. Working in the district for a long time, I know that having the EpiPens and everything there was wonderful, and it was a good opportunity. I was just wondering, with the naloxone, which I am not familiar with, that's why I'm asking this question, is it a class drug, or how potent is this, and how's it rated? Do you know? Thank you.
Madam Chairman, I'm going to leave it to the experts here that could possibly back me up with that question.
What good
Thank you.
scheduling I did. Mr. Martineau?
Chairman Wilson, Representative Ottman, a class or a scheduled medication is a controlled substance. And it goes from Schedule 1 to Schedule 5. Schedule 1 drugs are those that are highly addictive and have no medical treatment, so heroin, ecstasy, things like that. And then 2s, 3s, 4s, and 5s are the things that are usually used for pain management, anxiety, sleep aids, things like that. Again, they're habit forming, and hence why they need to have additional restrictions on them. Epinephrine is not a scheduled medication. It is something called a legend drug, meaning that it requires a prescription.
Excuse me for a minute, Martineau. Representative Larson, is there an emergency in the hall?
Sorry, can I catch Dr. Hallinan?
Is it an emergency? He's hearing. I guess you have to go do CPR or administer naloxone. You are excused, Representative Hallinan. I'm sorry, Representative, or Mr. Martineau, please back up about a sentence and a half. We were kind of distracted by the waving. At least I was.
Madam Chairman, the epinephrine auto injectors, or epinephrine in general, is something called a legend drug, meaning that a prescription is required in order to obtain it. It's not a controlled substance.
I hope you were following that, Representative Ottman. I found it a little distracting.
Yes, Madam Chairman, thank you very much for that. And yes, I was following. So the epinephrine, yes. How about the naloxone? Because that's the one that I honestly don't know a thing about. Thank you.
Mr. Martineau.
Madam Chairman, Representative Ottman, naloxone is not a controlled substance either. It likewise requires a prescription to obtain, though.
Well, we have a lot. Welcome back, Representative Worf. I don't know if I should let you ask questions after. Go ahead.
I did apologize for being late, Madam Chair.
That's right.
I'll
Go
explain.
ahead and ask your question.
Well, I'll yield to.
I asked you, just don't disorganize me. Just ask the question.
Thank you, Madam Chair. One of the questions I had, what's the shelf life of these? Do we run the risk of, getting it to where everybody's got one, but nobody's paying attention to when maybe they expire? Is there something we need to do to make sure that we don't have somebody that thinks they've got it and
Kind of
it's
like
no
quick
longer?
plot.
Yeah.
Go ahead, any person out there.
Madam Chair, Representative Worf, the shelf life on EpiPens range, there is an expiration date on it. It's usually about a year, can be a year and a half. When this prescription is dispensed, pharmacist counseling should include that pen needs to be replaced at least once a year. The expiration date will be pointed out on the prescription when it is dispensed. And so that would hopefully help ensure that the person that is getting the prescription for the first aid kit would understand that is a requirement.
And is it a one dose prescription or they come in a package of 10 or something?
Madam Chair, it is sold in a pack of two pens to a box. There are two different strengths, a child dose and an adult dose, and it is weight-based dosing on that.
So the prescription would be specific. So you'd get 2 pediatric or 2 adult, not one of each.
Madam Chair, that is correct.
Okay. And what about the naloxone?
Naloxone, Madam Chair, naloxone is, that is not really weight-based or any dose like that.
I mean, does it have a expiration?
It does have
typically?
an expiration, and that is another thing that would be covered in counseling with patients.
And is that usually 2 years, 5 years?
Madam Chair, that is usually about a 2-year expiration on naloxone.
Okay. Good question, Representative Worf. Good follow-up, yes.
Follow-up, Madam Chair. What's the disposal process? I mean, if we got pens that are gonna go bad, do people know how to handle the proper disposal of these EpiPens? And
Looks like Mr. Martineau is going to answer this one.
Chairman Wilson, Representative Worf. That can be kind of tricky. Sometimes patients will hold on to medications well beyond the expiration date just because they paid for it, they think it's still going to be good, and they're just wanting to not get rid of something that may work. Pharmacists are trained as far as how to instruct patients on proper disposal of medications. A lot of pharmacies nowadays have drug take-back bins where patients can bring in old and expired medications for destruction. FDA has a lot of information on their website as far as how things can be properly disposed of. And again, pharmacists typically get that question about how do I destroy this stuff, and pharmacists can walk patients through how to appropriately do that.
Representative Flitner, did you have a question?
Madam Chairman, thank you. Couple of questions. Fentanyl is in the opiate family, correct? And if so, if a person's having have a reaction or an overdose to fentanyl, would the EpiPen provide them with an assist?
Madam Chairman, Representative Flitner, no. Epinephrine would not assist in a fentanyl overdose. Naloxone would be used to try to reverse that. And with, both with naloxone and with epinephrine, part of the counseling is required to be like, part of the counseling that is required to be given to the patient is to what are the appropriate follow-up measures with these medications? Because it's not a one-time you administer this stuff and then anaphylaxis stops or the overdose is reversed. They have a time limit where they're going to have the appropriate action, and you still have to contact emergency services and get the individual appropriately taken care of.
Okay, and then one other question, Madam Chairman. Just out of curiosity, is there any other drug whereby you are allowed as either a practitioner or a pharmacist in good faith to prescribe without, the relationship between, like it says it on page 3, and I know that's existing statute or existing language, but I'm just curious how many other type drugs we allow to be placed, in someone's first aid kit without an actual prescription.
Morning after pills, probably. Go ahead, Mr. Martineau.
Madam Chairman, Representative Flintner, currently in Wyoming law, it's only naloxone. This would add epinephrine to that.
Okay.
Plan B is an over-the-counter that can be obtained. And again, people might hold on to it for whatever reason, like Tylenol or ibuprofen or something like that. But there's no special requirements of how to obtain that.
Okay, thank you.
Representative Stiver, did you have a question? Okay. Representative Ottman.
Madam Chairman, I have a couple questions too. The first one is would this be required to be put in all first aid kits, for example, in UW and in elementaries and high schools and things like that, if it would be required? And then the follow-up training for the school nurse or whatever, and also how that would be done. Thank you.
Mr. Martineau or Ms. LeBeau? Whomever.
Chairman Wilson, Representative Ottman, my understanding of the bill is that it effectively authorizes pharmacists and practitioners to issue a prescription to people who, the first case is generally that patient-practitioner relationship where the practitioner says, you need this medication, so here's your prescription to have it. It opens it up to where other people can have it as well. Someone who may have a family member who has an anaphylactic reaction, or someone who in the course of their duties may encounter someone having an anaphylactic reaction, so school counselors for whatever. My understanding is that there's not a requirement that every first aid kit suddenly have this in there. It would be the determination of whoever's getting it. So the university, if this is something that they want to have, then they'll be developing their own protocol of, we need to have it in this kit. This is how you check it and how often to make sure that everything's in date. This is the training that people need to have, things like that.
I do see on the bottom of page 6, it says voluntary participation. This article does not establish a duty or standard of care for a person to prescribe or administer. And it doesn't look to me, Representative Flintner, you were on education, weren't you? I don't recall what the statute is for the education folks, but this doesn't seem to open that up. Do you have any recollection from the school nurse side or anything? I do not. Oh, that's right, you're on education too, sorry. I was looking in that direction. Representative Stivar.
Thank you, Madam Chair. Within the school system, if a child has diabetes or allergic reaction, it's called under IDEA, it's the 504 plan. And that 504 plan, they'd have it on hand already. If
The school nurse.
The school, yeah, school
But
nurse.
based on that particular child.
Yeah,
It's not
but
just a random stock.
It's just not a random stop. It's for that particular child.
Okay.
Like for diabetes,
Right.
they've got the glucagon kits, all that. I mean, I've got 30 glucagon kits that are out of date. We won't go down that line.
Mr. Martineau can tell you how to dispose of them if you need.
I'd give
Okay,
them the
no,
Barbara
that's very
Davidson
helpful.
for training.
Thank you. Okay, any more questions for the panel here? Any other testimony? Oh, we do have one. I'm afraid Ms. Decklever will need one more chair. Introduce yourself for the sake of the record, if you would.
Madam Chair, Tony Decklever. I'm a registered nurse. I own a training center here in Cheyenne. And one of the things that I do is I teach people how to administer epinephrine and naloxone. And so by state regulation, foster parents, daycare coaches, they all have to have first aid CPR. And one of the components of that instruction is how to use an epinephrine pen. The legislature passed an opt-in program for schools several years ago that allow epinephrine to be stocked, not necessarily in a first aid kit, but to be in the school and without a prescription, because they get it from the pharmacy. And then school nurses and other folks, as secretaries or counselors or whoever, they're taught how to give epinephrine in the event that a student who does not have a prescription or does not have their own pen, they could administer if they are exhibiting allergic type reactions. So it's an opt-in program that the school districts do. And many of the elementary schools do have that program. Having this, I'm actually in support of this bill because I teach to hundreds and hundreds of people every single year. And they say, how do we get epinephrine if my child were to have an allergic reaction? My response to them is, your child has to have a first reaction that they end up in a doctor's office or an urgent care center or something. And then it's determined that they had an anaphylactic reaction and they would be prescribed epinephrine. So, and the other part that I teach, and as you heard in previous testimony, EpiPens are packed in duos. But what happens is mom takes it home and they break them apart. One goes to school, one goes to daycare, one stays home, one goes to work. So what we teach them is if you have to give epinephrine, then chase it with Benadryl. Because Benadryl is a wonderful antihistamine, and so
used
it
it.
works. Oh yeah, it's the #1 pharmacy drug for sleep.
No, I use it for allergic reaction.
Yes, but it makes about 95% of the population very, very sleepy also. So it's used that way too. But they often have that question: how do I get this? What if I go up camping and somebody has an allergic reaction because we have allergies in our family or something like that, and it would be really nice to have one of these pens. The thing that I teach and I coach my students is Epi. The Mylan version of Epi, which is the blue and orange pens, they're very expensive. But the company has a generic epinephrine pen that's much, much, much cheaper, and so people can afford that. There's another auto injector, it's called AvaQ, and that also administers epinephrine, which is adrenaline. That's all it is, pure adrenaline. But that one is really expensive, really expensive. So it's not used quite as much as Epi, but I'm in support of this because I think it would help a lot of people, but they do need training on how to administer it, because I can tell you just personally that I have seen people give it incorrectly. And so there's a little bit of training, but it's not a lot. But
Okay,
I'm
questions
supportive
for
of
Ms.
it.
Decklever, Representative Worf.
Yeah, and Madam Chair, if you'll allow me, not necessarily to this bill, but it's prompted a question that I have. I know there's a lot of businesses, a lot of people are required to take a first aid course. What would it take to actually make that part of that? Because I know I've gone through it. I've had to take first aid. I've been first aid certified for a long time, but to incorporate that, make that part of that, because it seems like to me this is getting to be a bigger and bigger issue. And I know I have a child that had reactions to peanuts, or to nuts. We didn't know that until we had the reaction. But I just wonder what it would take to actually make this part of your first aid training. And we can maybe talk later, because it doesn't have anything to do with this bill, but you prompted me to think, should we not incorporate that into the
If you've
first
got a
aid
short
training?
answer, but we're going to be so successful at getting upstairs early, it'll be really exciting if we show up early.
Everybody's gonna be
So-
shocked.
So short,
Go ahead,
Madam
Ms.
Chairman, Representative Worf, I use American Heart Association curriculum. It's mandatory. It's in every single American Heart Association first aid class
So it's already in there.
in American Heart. Now, and so some of the other first aid courses, I'm not sure, but I teach it in every single course. It's mandatory.
Good. Any more questions? Okay, thank you very much.
Thank you.
Any other testimony on this bill? Evidently not. Okay. Is there a motion on the bill?
Move the bill.
What do you do?
There's been several people moving the bill.
We've moved it together as a group, Bonnie. Cooperative action removed by Worf, seconded by Ottman. I don't know, I just picked them. Is there any discussion? Okay. Take the roll, please, Bonnie.
Representatives Connolly. Flitner. Hallinan.
Aye.
LeBeau. Ottman. Romero Martinez excused. Stivar.
Aye.
Worf.
Aye.
Madam Chairwoman.
Aye.
Madam Chairwoman, we have 8 ayes, 1 excused.
Okay, thank you, committee. Representative LeBeau will run this. So, committee, we did so well today that I'm going to give you Monday morning off. We will have plenty of other Senate, I mean, that's all we have received from the Senate so far. Looking at their list, we will, have something to do all the other ones, but they're not quite over yet. Not read in yet, and I don't think they've actually passed third reading in the Senate yet, so